Hi everybody and welcome to today's webinar on parent-led therapeutic skills for behaviour. My name is Rebecca Ratcliffe and I'm one of the practitioners in the mental health support team. The Mental Health Support Team, or MHST, is an NHS service that provides support for children in primary schools and secondary schools in Halton, St Helens, Knowsley and Warrington. And we aim to support young people in learning strategies of taking care of their well-being by providing interventions to pupils who might be struggling with things such as anxiety, low mood and behaviour, as well as delivering talks like this as part of our whole school approach offer. In today's webinar, we're hoping by the end of it, you should be able to understand why a parent-led approach is important, to understand the behaviours that you may be seeing in your children, as well as understanding and learning different strategies to manage that behaviour at home. We're going to start by thinking about why we take a parent-led approach when supporting behaviours of concern. Parents can be therapists every day, and you know your child better than a therapist ever could, meaning that you can have the biggest impact. We know, however, that this might feel quite daunting, and if you're watching this webinar, I have no doubt that you've probably tried many different things to support your child in the past, and you've probably received lots of different advice from people along the way. But there are a number of reasons why we would encourage you to work with your child on supporting their behaviours of concern. This includes the fact that as a parent, you can create lots of day-to-day learning in their life. Unlike one-to-one interventions with our team, which might be occurring on like a weekly or fortnightly basis, as a parent, engaging with your child every day allows for more opportunities of learning. Parents also often come to us because they are more motivated to make a change, because they can see the long-term impact that their current behaviours that the child is displaying could affect. We know that behaviours of concern have a daily impact for lots of families and they can increase parent stress. So often as a parent, you are more motivated to make those changes. As a parent as well, you can obviously apply these skills to multiple children. So you might be here at this webinar today, thinking about one child in particular, but if you have other children, these skills can easily apply to them, alongside the ability to pass on these strategies and skills to other family members who might be caring for your children at moments, so that you can all be consistent in your approach. This also means that future behaviours that are likely to occur can also be supported by using these strategies as well. The fact that you're here, you're watching this webinar shows that you're keen and you're motivated to help your child. So let's get stuck in, let's understand a little bit more about that behaviour and learn some strategies that might help you at home. It's really important that we try to understand the behaviour before we do move into the strategies. Trying to manage behaviour without understanding what lies beneath it is going to be a lot less successful. We know that all behaviours have a function and all behaviours are a form of communication. Often behaviours do not occur out the blue, and there are reasons for behaviours being shown. The iceberg model that you can see on your left is a really good way of looking at this. And I've got a video that I want to play now that will explain more about the iceberg model and how it can be really useful in understanding your children's behaviour.
As a parent, it can be stressful and exhausting dealing with behaviours that challenge, whether or not your child is autistic. Life is hard and no one is perfect. Sometimes parenting comes down to best endeavours and simply getting through the day moment by moment. However, by stepping back and thinking about your child's physical and emotional needs, you can start to identify the driving factors underpinning behaviours that challenge and avoid some of the triggers. An iceberg provides a useful metaphor. The behaviours that challenge are the tip of the iceberg, sitting above the water where we can see them, whilst your child's physical and emotional needs that are driving this behaviour are below the surface, out of sight. When we begin to link the two and understand the relationship between unmet needs and behaviour, we have a framework to help us promote positive behaviour and help us navigate a more peaceful family life. As with a lot of parenting, this isn't a magic cure, but instead can help us to identify small steps we can take that over time can start to make a positive difference. So what do we mean by behaviours that challenge, or the tip of the iceberg? Some examples are aggression, being disruptive, not listening, shutting down, running away, and behaviour that poses a risk to your child or those around them. Although these behaviours can be difficult and distressing for all, they're often the child's only way of communicating that they are struggling. Below the water sits the needs that are driving the behaviour. These can be divided into two categories: physical needs and emotional needs. Unmet physical needs include being hungry or thirsty, being tired, being over or understimulated. Unmet emotional needs can be a bit more complex to identify and resolve. They include feeling we have no choice or say, feeling we have little or no control over events, feeling unsafe, feeling unseen, unheard, or misunderstood by people around us, feeling insecure, not accessing needed comfort, feeling inadequate or incompetent, unresolved conflict. So the next time you're dealing with your child's behaviours that challenge, try to step back, use the iceberg model, and consider what could be sitting beneath the surface and triggering the behaviour. What unmet need might be underpinning their actions? Young people, and all of us on occasion, may not always know what's wrong and what is driving their behaviour, and so this may require some detective work. The great thing is, in identifying and addressing the underlying causes of behaviours that challenge, you can improve your child's quality of life, which in turn can improve your quality of life too.
As it mentioned on the video, it can take some detective work to be able to understand actually what emotions or needs are beneath the surface. It's really easy to identify those behaviours at the tip of the iceberg, but it can be really difficult to understand what's beneath them. STAR is an acronym that can support us with this and help us to understand a little bit more about what triggers or things might have actually led to the behaviour occurring. STAR stands for settings, triggers, actions, and results. And it's just a 4-point step where you can think a little bit more about a particular incident, to take some time to think about what was going on in the environment, what were the triggers, what were the behaviours that we saw, and then what happened afterwards. I'm going to go through in a bit more detail about these 4 points and then show you an example to demonstrate. So settings is the context in which the behaviour we see takes place. So this could be the physical environment, so in the shop, at home, in the park, or it could also be the personal setting. So that could include your child's well-being, their thoughts, or the mood that day. Triggers are things which occur immediately before the behaviour that we see. So this could be that the child was asked to do something, they were told no, the alarm clock goes off, the TV's turned off, or it could be an internal trigger such as pain. The actions then are those behaviours that we see. So an action must be something that we see. So that could include hitting, screaming, spitting, running off, hiding, any of those behaviours of concern. The result then is what happens after the action. So this could be a result for the child. So they might be able to access something that they like or need, or that they might avoid something afterwards. Or it also could be the response from people around the child as well. I'm going to give you an example of a young person named Toby and their mum Sarah. Toby in this situation displayed some behaviours of concern when in the supermarket cafe, and we're just going to use the STAR acronym to be able to really break down what happened. So in terms of the setting, Toby and Sarah entered the supermarket cafe after doing their big shop for the week. If you just take a few seconds now, just think about what could be some of the settings, some of the factors that we need to think about when we think about the settings. For this situation, probably it could be that they're both tired and they're hungry. They've just sort of did the big shop and found lots of yummy food, but wasn't able to eat it. But also maybe from the physical environment, it might be quite noisy or busy in the cafe. In terms of the triggers, there was sort of a conversation between Sarah and Toby immediately before the act before Toby showed some of those behaviours of concern. So Sarah asked Toby what he wanted to eat. Toby replied pizza. Sarah explained, no, you're just having a snack for now. You're having tea when you get home. Again, spend a couple of seconds and think a little bit about, what were the potential triggers that you could identify from this interaction between Toby and Sarah that occurred just before Toby showed some of those behaviours of concern. For me, the two that stand out the most would be um, Sarah has said no, you can't have something that you've asked for. But also potentially a trigger could be that there was a little bit of a vague instruction. Sarah obviously asked what you wanted to eat. Toby told her, but Sarah was meaning a snack. And maybe potentially if that was more specifically like, what snack do you want? That might have changed something. But for me, those are the two potential triggers from the example. The actions then were the things that Sarah saw Toby do. So Toby screamed, I wanted pizza. He started to stamp his feet and he threw the menus on the floor. Now, different families might have different results. For Sarah and Toby, once Toby showed these behaviours, Sarah felt quite embarrassed because he was doing these behaviours in a very public environment. It was very busy and noisy in the cafe anyway, and that's before Toby had started to stamp his feet and throw those menus on the floor. So this led to Sarah saying, okay, you can have the pizza, but you still need to eat your tea. Once we've drawn out the star in that way, we try to think a little bit about what that behaviour, those actions are trying to communicate to us. So you can see from the star that a lot of it is really focusing on the tip of the iceberg, but also trying to unpick what's beneath the surface. We can use I statements to try to help us with this. So if you think back to the example that we just talked about, what do you think Toby was trying to tell us when he started to show these behaviours? Again, use I statements to try and help you with this. It could be something like, I'm confused, because he was asked what he wanted to eat and he told her. I'm hungry. I've just been round the shop for, an hour and I'm really, really hungry. I've answered your question. I told you what I wanted. I'm tired. I'm overwhelmed. It's very noisy. It's busy here. I don't like making too many choices. Now, it could be a number of these statements, but it's really important to go through that process of writing it out in the start and then being able to work out what that behaviour is communicating to us using the I statements. Because once we get to do this, you can see now that we're starting to maybe understand some of the feelings that sat below the surface. By understanding what a child needs and focusing on trying to meet that need rather than focusing on those behaviours in the tip of the iceberg, it means that we can take a much more preventative approach. You can pause the video now if you want to and take some time to think about maybe a recent incident with your child. Have a go at drawing out their star and think a little bit about what their behaviour was communicating to you. Try using those I statements to support you as well from the things that you write within the star. These can be really, really effective at being able to unpick things, especially if you're a family where your child's behaviour appears to come out of the blue, where there's no obvious triggers. As I said back before, all behaviours are a form of communication, and often behaviours do not occur out of the blue. There are some triggers, or maybe some things within the settings which could explain as to why we've seen the behaviour that we do. We're going to really focus this webinar on exploring the R of STAR and looking at the responses from people around the child. This is going to bring us back to sort of the psychology really behind behaviour and the role of attention. Bandura proposed that any behaviour that is being reinforced immediately is more likely to occur. What he meant by that was that the more attention that we give to a behaviour, the more likely it is that that behaviour will be repeated. The less attention we give to a behaviour, the more likely it is that behaviour will stop. The attention table is another way of looking at this. And what we tend to find is that if we give lots of attention to positive behaviours, those positive behaviours will increase. But likewise, if we give lots of attention to those not so positive behaviours, they will also increase. What we tend to find is lots of families do give lots of praise and rewards and positive attention for those good behaviours, but there might also be times that they're also attending to those negative behaviours just a bit too much. If we can try to reduce the amount of attention being given to those negative behaviours, we should be able to see them decrease over time. An example of this is really, really common, something that we all experience would be if you're at home and your children are in the living room playing really nicely, getting on well, you would take that opportunity to maybe get on with something you needed to do in the house, as we all would. But in that moment, we might not particularly praise them for getting on nicely and playing nicely. We've just seized the opportunity for a bit of quiet time at home. However, the moment that you hear them maybe arguing in the living room, you would go in and potentially tell them to stop arguing, or you'd shout from the next room for them to stop. What we've done in that situation is therefore given attention for those negative behaviours. And even those tiny little things like that can still add up over time. Again, though, we're all human beings, so I'm not expecting you to be able to go away and be able to spot every single time that your child is behaving and to ignore every single time that your child is not behaving. But it's really important to just hold this attention table in your mind and maybe understand a little bit more about the psychology behind how behaviours can be repeated. With that in mind, we're going to think about strategies that sort of work with us in terms of that attention table. We're going to first be thinking about those strategies that will help you to increase your attention towards the behaviours that you want to see, those positive behaviours. And we're going to do that by thinking about things such as quality time, praise, and rewards. Quality time is all about the power of play. Play is defined as engaging in games or other activities for enjoyment rather than for a serious, practical purpose. We know that play can look very different for every child and family, but it is a really powerful strategy to provide you with a strong foundation for managing tricky days. What we do know from working with families, however, is those play like moments and those playful moments can often be lost because those behaviours that challenge can often get in the way. Quality time is all about you investing time with your child to play and have those playful moments. Quality time should be delivered consistently, but we know that time can be precious, so it doesn't need to take up too much of your time, but we would recommend for at least 5 or 10 minutes a day, but if you can do more, even better. Quality time is a specific type of positive play that supports in building the parent-child relationship. It is a child-led play, which will look different to some other types of play that you might do with your child. When you're having quality time, I'd encourage you to try to really pay attention to your child. Be in the moment for those 5 or 10 minutes, phones away and all of the distractors away where possible. Be aware of your pacing as well. Play at your child's pace and be patient. Try not to rush them. This is supposed to be fun and enjoyable. Parallel play as well is really important for this type of play. Try to copy what they're doing and comment on what you're seeing them do. Sort of say what you see rather than asking questions. Try to keep it positive. Even if it makes no sense to you, just celebrate whatever they're doing. And remember again that play is for enjoyment. It's about having fun. It's about being in that moment with them, having fun. Try to do less of these things. Again, this is a very specific type of play. So try to sort of avoid asking questions, especially if you're somebody like me who often would try to perhaps turn it into like a maths moment or teaching moment where I might say, oh, how many cars have you got? What colour is that block? Sometimes if we ask these questions, then that can make it less enjoyable for your child. And obviously teaching moments are needed in certain types of play, but actually this type of play is not about that. So for these 5-10 minutes, avoid asking those questions and just try to comment instead. Try to avoid asking other questions as well, or try to correct them. It's really tempting to say, oh, that doesn't go there, but try to hold back and again, let your child lead you in the play. If they tell you that pigs can fly, pigs can fly. Just sort of accept it and go with it. And try to stick with it as well. Try not to quit this type of play. It might feel quite repetitive or boring for you, but try to stick at it as you're showing them that they matter. It can be quite hard to practice this skill of play. It does take some adjusting. It's not really the typical way that you might interact with a child. So the biggest thing mainly is just to try to avoid those questions and try to comment instead. You can comment on things that they're doing, so their actions, their cognitions, their thoughts, or their emotions. So you could comment on the things that you see them doing, such as like you're pushing the car along the road. You might comment on their thoughts, or you look really proud when you push that car along the road, or their emotions as well. As well. I'm just going to play this video now, which goes into it a little bit more and gives a couple of examples about how you can turn questions into comments. This is for maybe more younger children, but the process of this specific type of play can easily be adapted for older children. It's just going to look a bit different, but you can join them in things like an Xbox game, a board game, going to a cafe, watching them play a game on their phone, anything like that. It's just where you take 5 minutes to be able to just join them in their world, and whatever that world looks like for them, depending on their interests and their age.
Imagine eating a sandwich while sitting with a friend. They are interested in your sandwich and you're happy to chat about it, but they keep asking you questions. What is in your sandwich? Why did you choose that? How do you spell the word sandwich? The questions might start to become annoying. It's the same for your little one when they are playing and chatting with you. When you ask lots of questions, the conversation can start to feel like an interview or a test.
And what's that over there? Is that a car? Ooh, who's driving the car? What colour is the car? It's a nice car. Is it blue or is it red?
Lots of questions can lead to short answers and short conversations. Your child may feel under pressure and appear frustrated. Turning questions into comments helps chat and play to last longer and feel more relaxed. To comment, talk about what is happening using short sentences. Focus on what your child is interested in, what they are doing, and what they can see.
I thought he was coming home. Oh, he's coming home in his car. Hello, Spider-Man.
It's Venom.
Oh, it's Venom.
Hopping out of his car.
He's hopping out of his car. He knocked down the house.
His house. Not on his house, there's no one in it.
Comments show interest in what your child is doing and saying. They encourage a response without putting much pressure on your child. Your child might respond with words, actions, noises, or gestures.
Hello.
Finding a balance between questions and comments allows play and conversations to flow. You will ask some questions, and questions can be very useful, but at least 3 or 4 comments to every question is a great balance to start off with. We hope you enjoy turning questions.
As I said, although that video is sort of aimed more towards younger children, the skill of just being really attentive to your child and it being child-led can still be applied to teenagers. It's just going to look different because their interests are obviously very different to those of a younger child. Praise and rewards is also really, really important. Again, thinking back to that attention table, we know children that get attention for doing something are more likely to do it again. So it's really important that we focus on praise and rewards on the things that we want to see more of. Praise can also be really good for building positive self-esteem and letting the young person know that they're loved and they are appreciated. Praise can look like lots of different things for lots of different people. Sometimes we can praise for effort, and we would encourage you to praise for effort more so than sort of attainment. So saying things like, you worked hard on that maths homework, well done. Non-verbal praise as well can be really, really good. Things like a smile, a hug, a touch, a cheer, a high five can be really good, as well as using specific praise statements such as, good job at sharing your sandwich with your sister. I love seeing you play that game. You're really good at it. There are lots of ways to build up your skills in using praise and rewards, and it's just about noticing how your child responds to praise and encouragement, and then you'll know what works best for them. Every child is different. Not all children like praise, so for children who are not a big fan of praise, maybe a non-verbal approach would be better. Whatever type of praise that you do give your child, it's really important that your praise is specific and sincere as well. Make sure that you name the behaviour that you're praising them for. So rather than saying well done, we'd say well done for sharing with your sister. Try to give that praise immediately as well, because that's going to help your child's brain to link the praise with the reward, which means you're more likely to see that behaviour occurring. Try to avoid muddling that praise with any criticism as well. So thank you for picking up your toys. Finally, will lead to your child potentially only remembering that criticism. And remember, any praise is really important. So just always try to praise them in the right direction, and remember to follow through with your praise as well. Rewards are really effective at being able to motivate young people. Not all children respond well to rewards either, but I would encourage you to try to promote it as much as possible. Rewards are often thought about as money, gifts, or food, but really quality time is the most powerful reward for your child. So things like playing a game, reading a book together, cooking together can be rewards as well. And I would encourage you to think more about non-monetary stuff, that quality time stuff first. Rewards are not bribes. They are given after a behaviour is shown, whereas a bribe is given before. So just make sure that you're only giving that reward after a behaviour is shown. Otherwise, you might find that you're actually giving a bribe and it's not actually as effective. Things like reward charts can be used, or I've put a little colour by number picture there, which again works very similar, but as soon as they sort of show a behaviour that's positive, they could colour in a section of that, which would slowly build up over time and not put too much pressure on sort of having to do X amount of things a day.
Children really need attention, and they can go to any lengths to get it. Even negative attention can be better than none. Although praise and positive attention are the best kind of attention, and children just love it. Monica used to kick a football against the wall whenever I was on the phone. It can make you feel really angry, and you might want to tell them off or punish them by removing a reward. But it's really important to pay attention to the things we want to see more of, and not just the behaviour we want to stop. Monica, I need to make an important call. Can you do something quiet for a bit? Then we can play football together. Once they work out that you'll praise them for doing something, they will do it over and over again. Thank you, Monica, that was great. I had a whole long chat and you were quiet all the way through. You're a star. Shall we play football together now? Big changes won't usually happen overnight, so keep going with praise and rewards for all the effort your child makes until they get the hang of it.
We're now going to think more about the strategies where we can remove some of that attention from the behaviours that we don't want to see. Again, thinking about that attention table when using that to our advantage. We're going to be introducing you to the skill of selective ignoring, as well as thinking about how to make instructions and consequences effective, alongside using calm time to support this. Selective ignoring is one of our main strategies that we do recommend, especially for low-level behaviours. This is all about removing that attention. And if we remove that attention, then those behaviours will decrease. Selective ignoring is key in terms of consistency. If you do ignore a behaviour once, you need to keep up with that. So I'd really recommend just maybe selecting one behaviour and then giving the skill of selective ignoring a go. Try to be neutral with your expression and tone of voice when you do ignore them, and try to do something to maybe distract yourself to sort of stay calm. It is really hard to selectively ignore. Again, this is a skill that takes quite a lot of practice. But as soon as they give you, as soon as they stop behaving, stop misbehaving, then try to bring your attention back to them and look for something to praise. Remember that you're not ignoring them, you're ignoring their behaviour, and you can let them know this as well. Lots of parents choose to do this because selective ignoring your children doesn't always feel comfortable. What we do need to be aware of, however, that any behaviour that you ignore sometimes can get worse before it gets better. So we'd only recommend using this with low-level behaviours like moaning, swearing, backchatting, pulling faces. It's not for dangerous behaviours. You can imagine if you was to use this with a dangerous behaviour and it was to escalate, then it could put themselves or others around them at risk. So only use this for low-level behaviours. Also, just to add in here as well, if the behaviours that you're seeing are due to the fact that your child is neurodivergent, I wouldn't really be recommending that you selective ignore them. If they're showing you some of those behaviours because they're distressed or they're having a meltdown, it's really important to encourage regulation. And we do have a separate emotional regulation webinar that you can watch to give you some extra tips.
I used to react straight away when Aaron misbehaved at the dinner table. For goodness sake, stop messing about and eat your dinner properly for a change. I didn't realise the more I focused on him at the time, the more he would want to misbehave. I eventually learned that it was better to selectively ignore these moments at the table. I admit, it wasn't always easy to do. Sometimes children display minor misbehaviours that are not dangerous for them or others. If we can consistently ignore these specific behaviours, it can teach children that these behaviours are not the best ways of gaining our attention or connection. At first, a child might continue to misbehave when you are selectively ignoring. This is the time to stick to your guns. Selective ignoring can be one of the hardest things to do consistently. But it does work. It's also important to give attention back to your child as soon as the misbehaviour ends, and to praise their good behaviour. Wow, Aaron! You're doing a great job of eating your dinner. I really like how nicely you're using your knife and fork. It can be very hard to stay in a calm and positive mindset when you're trying to ignore your child's misbehaviour. If you can persevere, you're likely to notice that your child's behaviour will eventually change for the better.
As I said, it is a skill, so it does require quite a lot of practice. So I really would recommend for you to just choose a really small, low-level behaviour for you to give it a go with and just see it in action. To support with this, making your instructions effective is really important. It can take around 15 seconds, but for some children, up to 2 minutes for them to process an instruction. So we need to ensure that any instructions that we give are really clear and that we break down the tasks that we're asking a child to do. Training instructions, for example, get your shoes on, come downstairs, put your coat on, get your bag on. Lots of information for your child to process, and it's a very high chance that they're going to forget some of that. So it's really important we break it down and we give your child space to process the instructions. And also give them a choice when we give an instruction to still give them a bit of ownership in what they want to do. So we often might say things like, do you want to put your socks on? Which might give them an option to say no or put your socks on. But you could give them a choice there, still with the same end result. So do you want to put your red socks on or your blue socks on? Just by slightly changing it a little bit allows for the young person to feel more in control. And also you can also think about adding visual aids as well to support with the things that you give instructions for.
I realised a while ago that whenever I would ask my children to do something, they never did as I asked. It took me a while to figure out why this was happening so much. The reason I couldn't get her to do anything I wanted her to do was because I was sending her confused messages all the time. Okay, now you're home from school, go upstairs, change out of your uniform, put your school bag away and wash your hands and face, and then come downstairs for your dinner. Sometimes parents are not aware of how many instructions they're giving to a child. Some estimates say parents give up to 40 instructions every half an hour. If we give children too many instructions at once, they may feel overwhelmed and unsure of which instruction they should follow. I see you've come for your dinner, but what about all the other things I asked you to do? It's important to decide on which instructions are most important and only give the ones that are most necessary. Okay, it's time to put away your toys now because it's time for bed. Giving children clear instructions is important as it helps them to understand what you expect of them and can help make them feel safe. If we give children instructions that are clear, calm and one at a time, they will have a much better chance of being able to do what we ask them. When we carefully consider how we give instructions to children, they will feel much happier, and so will we.
Instructions help us to create routines and boundaries, which do give children a sense of safety. But we know that children will often push these boundaries, which will then result in you having to give them a consequence. There are often two consequences that happen. A logical consequence, such as if you don't get off your tablet now, then I'm going to take 10 minutes off your tablet tomorrow. But we also have natural consequences. So if you tell your child to stop running with their ice cream, they continue to run, they trip and drop their ice cream. That is a natural consequence, and that's more where they're learning from their mistakes. When you are giving a logical consequence, especially, try to make sure that you can live with the consequence. We often have lots of families where they might say, "Oh, if you don't stop that now, then we're not going on holiday." But chances are you're still going on your holiday. You've paid for it. Your bags are packed. You've got your passport. So it's really important to make sure that those consequences are ones which you can live with, and also that they're appropriate as well for the behaviour. Try to give the consequences again immediately, similar to what we said with praise, just so that the brain can learn the link between the consequence and the behavior. Try to again give warnings and choices so the child can correct their behavior before you jump in with a consequence. And using if and then statements can support with that. So if you continue to not listen to me, or if you don't get off your tablet, then I'll take 5 minutes off you tomorrow. And as long as they're safe as well, you can allow them to learn from their mistakes. Like I said, with the ice cream, if they ran and then dropped the ice cream, that is bad enough, for them, and they don't necessarily need to have another consequences sort of added to that. Calm time is a consequence that you can also give if they have persistent non-compliance of instructions, or if they're displaying some more dangerous, destructive behaviours. Calm time should only be used for a short amount of time. And really, before you use calm time, you should be talking to your child to explain to them about what the behaviour, what behaviours would put them into calm time and why you'd be using it and where calm time is for them. Um, it's really important that you give your child a clear warning before calm time. Again, giving them an opportunity to make a choice. As well as trying to withdraw as much attention as you can, but also staying present for them so that they know that they're safe. It's really important you give praise to them once they're calm and they're quiet. And at a time that's suitable, you can revisit the reason for calm time, but I wouldn't give too much attention to it in the moment. Try to focus on another activity in the moment. Try to stay positive. And I would encourage you to try to have some sensory-based things for them to use in calm time, like a fidget toy, weighted blanket, those sorts of things. Don't see this as a reward for them, because actually the purpose of calm time is not as a punishment. It's allowing them to see that I'm too angry right now to make good decisions, which is okay to be angry, but I need to take some time now to calm. So using sensory-based strategies can support with that. You'll notice that this video uses the word timeout, which is the same thing as calm time. I've just tried to rephrase it a little bit when I introduce it to children, because it allows for them to understand the purpose of this is to calm rather than timeout, which might feel more negative. But either of those is absolutely fine.
There are times when Monica becomes so frustrated or angry about something that she totally loses control, especially with her sister. When that happens, even I struggle to keep calm, and then we're all in it together, and that really doesn't work. One thing I've learned is that giving my child a timeout can really help them learn to manage their feelings. It's important to talk to your child first about what will happen when they go to timeout at a time when things are calm. If they understand when, how, and why they are having a timeout, it will help them to cope better when they do need it. Monica, it's okay to get upset, but it's not okay to pull Nina's hair. So, when this happens, you will go to timeout, which is over here. You will sit quietly and take some deep breaths. Then, when I can see that you're calm, you will come back and play. Timeout should be very brief, as one of the aims of timeout is to give your child a chance to try again as soon as possible. Right, like we said, it's not okay to pull Nina's hair. Go to timeout. Timeout aims to give children a chance to be removed from a situation that has become overwhelming for them. It gives them a chance to gain control over very big emotions. Timeout is also a good chance for parents to manage their emotions too. But as soon as timeout is over, it's time to move on. I can see you're calm now, Monica. You can come and help finish making this building with us. Of course, that makes it look really easy, and in real life, it doesn't go that smoothly straight away. It's worth persisting though.
You can support children to just regulate their emotions as part of that calm time by teaching them things such as like breathing techniques or grounding techniques like 5, 4, 3, 2, 1 that they could use within calm time. I think again also you as parents modeling your regulation strategies to them can be really effective, teaching positive self-talk and making sure that they know that all feelings are valid even if their behavior is not. So again, it's okay to feel angry, but it's not okay to do X, whatever it might be. And it's really important that as a whole family, you're talking about your feelings and validating all the emotions that your children are displaying. It's really important that you also take care for yourself, really, and don't forget to look after yourself. It's vital and it's not selfish to have that self care. If you think about when a child displays some distressed behaviours, what sort of negative emotions a parent might experience because of this? It could be things like stress, anger, anxiety, upset, guilt, and other emotions as well. We also then think about how might those emotions affect how you as a parent responds. You might feel less patient, you might be rushing them more, shouting, giving in more easily. And thinking about what we've talked about so far, some of these responses might have a knock-on effect to your child's behaviour, though that behaviour might increase. And so you might find yourself sort of stuck in this bit of a cycle. And that cycle is really important for us because it has a really important name, and that is called being human being. You are doing your best in a tricky situation, but being aware of your own emotions and responses could be a way to support your child. By looking after yourself, this can have a positive impact on your child. And there's a couple of things that I want to cover in terms of how you can take care of yourself. One thing that you can do is try to notice your thoughts. Thoughts are really powerful at impacting the way that you feel and the things that you do. I'll give you a scenario. Imagine you're walking down the road, you see a person, a friend, you wave, but they don't wave back. What possible thoughts might come into your mind? I'm going to give you 3 that I've thought of, but you might have thought of other ones or maybe similar to this. One might be, oh, that I must have upset them, I've done something wrong. Another one might be, oh, they mustn't have heard me. And the final one might be, how dare they? They just walked past me and ignored me. You can think about these thoughts and see how actually they change the way that you might feel. So if you're thinking, I must have upset them, I've done something wrong, that might lead you to feel quite worried or embarrassed. If you think, oh, well, they mustn't have heard me, you might not really have any feelings, might be quite neutral, or in fact, you might actually be concerned for your friend and think, oh, what's wrong with them? I hope they're okay. And equally, for our last thought, if you're thinking, oh, how dare they? They just walked past me. This might lead you to feeling angry or annoyed. Again, we can then think about how those thoughts and those feelings affect what you do. So if you're feeling worried or embarrassed, you might then tend to avoid them further in the future, maybe overthink things. If you think, oh, well, they mustn't have heard me, and you didn't really feel any particular strong feelings for it, you might think nothing of it and carry on with your day. In our third example, if you're thinking, how dare they, you're feeling angry, you're feeling annoyed, you might tell friends, send them a message, or even block them. This doesn't mean that everything is suddenly going to be solved by trying to swap on negative thoughts for positive ones, but by noticing your thoughts, it can help to reduce the intensity of your own feelings. When we have negative thoughts, it's really important that we're going to be kind to ourselves, and we can do this by thinking compassionate thoughts. Think about what you'd say to a parent who was struggling and try and say this to yourself. It might sound something like, you can do this. This is only temporary, things will get better. You've managed this before, you can do it again. Also, remember there are a lot of support options out there for parents and for adults. There are national charities such as Mind, and there are also local services such as talking therapies. I've popped their numbers on the screen there, and they provide a very similar service to ourselves, but for adults, supporting with things like anxiety and low mood. You can self-refer to their services by calling the numbers on the screen now. There's also a lot of support out there for young people, so don't feel like you have to tackle this on your own. School staff are going to be really key in supporting you with these behaviours of concern, as well as potentially our team. If your child goes to one of our schools, please do speak to the mental health lead about asking them for a possible consultation to see if your child could be referred to our service. Likewise, I've popped the numbers for the 4 CAMS teams in the area. They also can be supporting you in supporting your child with their wellbeing, as well as national places such as Young Minds and Cooth. If you do have an urgent mental health concern for yourself or your child, you're concerned about their safety or someone's safety around them, please contact 111. Thank you for listening to today's webinar. I know that it's quite a lot of information, so again, please do come back to this video, play and pause in moments where you need to. And we really do hope that you've taken some strategies today that you can implement. Try to be kind to yourself and just try out 1 or 2 things at a time. I wouldn't expect you to leave today and suddenly try everything. But don't forget to look after yourselves as well. You can't pour from an empty cup, and that's really, really important to remember. We would be grateful if you could complete the feedback form about our webinar today so that we can make any changes for future webinar. You can do this by scanning the QR code. Thank you for listening again, and take care.